social media is now an extension of everything about your practice, and the patient experience often happens when you're not even in the room. You're not even part of the conversation. Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I'm Corey.
And today we're going to talk about what 910 million mentions on social media says about the future of social media in 2026 and what this actually means to healthcare practices.
That's a lot of mentions.
910 million. That's like almost a billion.
Yeah. And
do you
okay, so
that individually?
No.
God bless it.
Right, exactly. This comes from Brandwatch, and I think so. I'll start with this. So they produced this State of Social 2026 report after combing through all these mentions. One of the biggest takeaways to me was that 99% of brand conversations happen without brands present. So, in other words, specifically for healthcare, that means most of the story about your practice is being told without you. And so that means people are talking about their care experience, maybe a billing surprise, maybe it's an access issue, maybe it's something that an employee didn't say but was attributed to them, and it creates a giant firestorm, which we have experience with. Trust and safety concerns, all these things are happening and you may not even be aware.
Well, yeah, we have a lot of experience with that because we had a practice this year where we all went to bed at night and everything was good. And then we woke up and a video had appeared that had nothing to do with the practice, but we had gotten tagged in it. And thank God we got tagged in it because we may not have known. Granted, they had 300 phone calls within the first hour of the day, and we did know, but the majority of it, like within like a week, I think the number was something like 1 million impressions or 1 million views and 10 million like impressions, and then like maybe 100,000 comments had happened. And that all happened without the brand even being there, which just tells you that social media is now an extension of everything about your practice, and the patient experience often happens when you're not even in the room. You're not even part of the conversation.
Right. Yeah. And with healthcare, especially, there's you're uniquely kind of exposed, if you will, on social, because there's typically higher emotion, higher stakes, higher trust requirements. It's not like somebody's buying a widget. So, it matters specifically to healthcare because these conversations are going on whether you know about them or not. And I think it's worth spending a couple of minutes just to kind of dig through some of what Brandwatch had to say here after going through all of these mentions. So the next one that they talked about is trust erosion and how that hits healthcare harder than most industries. So I think it probably goes without saying, but trust is breaking down across a lot of social platforms today for various reasons. But in healthcare, this broken trust, it doesn't just hurt the reputation. It can affect care decisions. It can impact provider choice, referrals, all kinds of things. And so if we're looking at mentions of hidden fees as an example, or extra charges, when we're looking specifically at healthcare, that was up 40% from the year prior when we're talking about just healthcare alone. So that means we're talking about surprise medical bills, or confusing insurance explanations, or poor financial communication from the practice, whatever those things are. If you just kind of think about yourself in the shoes of the consumer, they're going to walk away from the office frustrated. And in today's day and age, they're probably going to pull out their phone, they're going to jump on social, and they're going to complain about it. They're going to mention you specifically for these things.
I think that's really interesting because, it's 910 million comments. And I would love to know if the issue about hidden fees and extra charges being up 40%, if that's hospitals or independents, because
Yeah.
my gut tells me that's hospitals, because that's where really the conversation about the transparency in billing is at a national level. We have the No Surprises Act and things like that, at least with our with a lot of the practices, we've got those policies published and whatnot. But if you're an independent practice and you're hearing this, so we know that these conversations are up by 40%, then why don't you, from a marketing and messaging standpoint, lean into we're not going to hit you with unnecessary bills. Cost to cost, it's going to be less expensive to go to an outpatient surgery center than it is to go to the hospital. We make understanding your insurance easy. Like, you can lean into the opposite messaging because this data is telling us that this is a real thing. And it's being talked about when the practices aren't even in the room and people are taking it into their own hands. You've got an opportunity here, practice.
Yeah, and that is why, billing transparency and this expectation setting, it's now a social issue. It's not just an operational one, because these complaints and this confusion, it lands on social, and it's not just, a voicemail that you get and you got to respond to the next day or whatever it is. It's something that's very public, and it can impact decisions and care choices for sure.
Yeah, totally. So the next thing that came out of this, really, which I thought was interesting, is that the report talks about something called de-influencing. So it's basically like de-influencing maps directly to patient warning behavior. And it's saying that mentions of de-influencing is up almost 80%. Consumers are actively discouraging other people from going and making a bad purchase or a bad decision. And from a healthcare standpoint, that means like patients are warning other potential patients. And they're doing this, by the way, and you're not even part of this. They're not doing it on your page. They're doing it amongst each other, because social is a live communication stream where it could be very public, it could be private, it could be whatever. But patients are literally warning other potential patients about your lackluster bedside manner, or how long they waited, or the fact that your front desk person was rude, or of billing problems. Like, I don't understand why I got a bill if I have insurance, or why, I already met my deductible. Why am I paying this doctor and not this one? Or their scheduling experiences. Like, this is what people are doing, and they're actively working against you to de-influence your practice.
Yeah, I have never heard that term before this, but I totally get it. I mean, it's, yeah, like you said, it's people telling others what not to buy or what service not to go to. It's basically like a crowdsourced, do not recommend this thing, which is crazy. And to me, one of the key kind of takeaways is that this one experience no longer, it doesn't say private. It's not just a 1-star review on a listing, but that person is going to go and, they are, not everyone, but some people are kind of, mini influencers, if you will, and kind of,
they like to think they are. Yeah.
Yeah. And like their own network. So if they have a bad experience, they might leave you a negative review, but then they're going to put a reel or a story or something together, or they're going to hop in their next door group, or, they're just going to scream from the rooftops to whoever will pay attention to them. And unfortunately, a lot of these social platforms, they thrive off of the anger, because it just it helps keep people on the platform. So if they're getting decent engagement by talking trash, and this isn't official, but if they're talking trash and it's getting lots of engagement, the platform may show that to a couple more people, because the more engagement, the more eyeballs on the platform, the more money they make from ads. So if that's what's trending at the moment and you're at the center of that, then sucks to be you at that moment.
Yeah, it does. And that's kind of what happened with our orthopedic practice when
Exactly.
they had that video come out. Like there were so many comments and mentions, and we kind of had to ride the wave, but we were like super proactive, and it took a while for it to go away. And that's kind of what it is. And when we used to talk about social, we would talk about like getting pictures of the office staff, which is still important, and putting them up there for Doctor's Day and recognizing and like just being consistent. But now there's this whole other layer. And it really ties itself back into almost like just reputation management in general. Yes, you got reputation management in terms of your Google listing and your Healthgrades listing and all of that. But, social media is like the ultimate in reputation management, and it requires a very active and hands-on approach.
Yeah. And that kind of ties into the next thing too, is that customer service is now the #1 social flashpoint. So in other words, so according to Brandwatch, their data says that calls to boycott places are up 95% in 2025, which is an insane number. But going back to the case study, like we were just talking about, that definitely happened while we were going through that. People were calling to boycott that particular practice
from all over the world. It wasn't just local.
Of something they actually had nothing to do with. But these do not buy mentions, according to Brandwatch, reached 836,000 plus posts. So, for your practice, that's something like, don't go there, avoid this doctor, it's the worst experience of my life, whatever it is. And there's a lot to unpack there from just social media in general, just turning into a place I don't want to spend a ton of time. But a lot of people still do, and it's still, like we were saying, it does impact a lot of those decisions, because you can do everything you're supposed to leading up to that. You can build the brand, you can have the content, you can have the reviews, but then if the wrong person has the wrong experience, it can blow up in your face.
Well, and also, like, there's so many practices that still don't monitor the inbox with social. And we monitor, like we have a monitoring system. We're paying attention to it, just so we're paying attention to the reviews. When something comes in, we're escalating it. But you got to think about it, like that inbox is also, it's just like your phone line. And, if you've got a complaint, granted, maybe you're doing it publicly because you're one of those people, but you're also there's people doing it privately. I had an issue with a flight. I was on the flight and I had like a 15-hour flight ahead, and I had purchased first class, and I get on the first leg of the flight and I'm basically in coach, and I about lost my flipping mind because it was going to be like a 15-hour flight. Right. And I didn't realize that the way that they interpreted my first versus coach is they didn't book somebody next to you, so you had more room. But I'm telling you, I was losing my mind. So I'm on social because I was like, I can't go to the website and figure this out. I got to go to social and use the inbox. And I'm reaching out to customer service trying to get an answer, and I never got an answer.
Mm-hmm.
And think about that. Like, what does that feel like if you're a healthcare consumer? And, granted, I know the practice doesn't want people asking, like, cancel my appointment, or what's my follow-up, or what's this, or what's that. Mm-hmm. And, in social app, but that's what it is now, guys. And you got to have a game plan for how you're going to manage that, because, if you're focused on social media or focused on customer service, but you're not including social in that customer service, then you're doing yourself a disservice, because there's lots of conversations taking place around you that you want to be part of. And social happens to be where those conversations are happening.
Yeah. And it's one of those things too. I think, we're kind of tongue in cheek saying like, it's all downhill and what have you. But a lot of people still, if they're going to go talk about a brand, a lot of them, if they have a perfectly satisfactory experience, they're not going to go talk about it. They're just going to move on.
Yep.
So, and it just one thing to consider for context. So if there's a ton of mentions about do not buy, do not go here, a positive of that is there also are hundreds of thousands of people that had good experiences And again, going back to the numbers here from Brandwatch, they say that mentions of helpful customer service exceeded 348,000 mentions, and the term stress-free as a service mentions are up 74%. So there's still some people that are going out there and saying, hey, they made this experience great, they solved the problem. But I mean, it's just human nature. If you have a bad experience, you're gonna talk about that more than a positive one. What's the old number? Is it like you're going to say that's like 5 times more people?
Yeah, it's like 7 people more you're going to say if you have a bad experience with.
Right. And that's exactly what social is, but they just amplify it.
Yeah, and social is that place that people who are afraid to say it in public, like they're non-confrontational, they got no problem saying it on social media. Which leads me to the next kind of key point here, and that is we're all kind of going through this digital overload. Like, it really resonates with me, Corey, that it says like that digital detox mentions were up 10%. Man, if I could detox, I would live in a state of detox because it's just there's too much to deal with. And anxiety related social media mentions are up 25%. If you are a practice who is in the mental health space, that is your big opportunity, because it's the truth. Like, we're just all overloaded by media in general. And social is just right there with it. You know, people are doom scrolling, laying in bed, and they wonder why they can't sleep at night.
Right. People are feeling overwhelmed. Their feeds. I was talking to a group the other day, and we were discussing kind of brand messaging for some ads and things. And they just recently rebranded, and they were like, yeah, we don't want any sort of like fear-based messaging in anything that we do, because we don't have to tell people that. They get it. Like, we don't have to show them that. And we've said for a long time, you know, if we're doing like images and ads and things, like, you don't want to show
me the needle. I don't need to see how painful.
You don't want to see the needle. You don't want to see the person holding their knee or whatever. You want to talk about the after. And in the past, just sort of advertising 101, you know, using fear or FOMO works really well. But I think that there is kind of a shift away from that. It's a slow shift, but it's a big boat to turn. But people don't want to see those things anymore because they are anxious and they do have so many other things going on. So to me, the takeaway is that this calm, educational, kind of reassuring content wins, because that's the stuff that people want to interact with. As an added benefit to that, it also establishes your group as you know, an authority in the space, and that you know what you're talking about. And so it's positive all the way around.
Yeah, totally. And I think that it like transitions right into, you know, we're all tired of seeing too many ads, and especially ads that might be misleading or something to that effect. Now, I know that Meta has gotten really good about like, I don't want to say really good, but they put in some guardrails related to healthcare specific ads. We did an episode on some of the changes that Facebook did at the beginning of 2025. It has made the world a little bit, little more difficult, like a little more nuanced in getting your ads approved. But at the same time, like, I think it's been a good thing, because when you're looking at what Brandwatch says, 54% of ad related conversations are anger related. So when like this is like, that's something to think about here. Like, when we had this issue this past year, giant dumpster fire with this ortho practice and this video, the comments weren't just on our social channels or about us in other channels. They were also on all of our ads. And so we ended up turning all the ads off, even though they were positive ads. The negativity was spilling over to the ads that we were running and spending money on to make sure people saw them. And then every time people saw them, they also saw all the comments were being associated with them. And then another thing Brandwatch said is like 90% of clickbait mentions were negative. We don't do clickbait. I don't know of a lot of practices that do clickbait, but I think it's important to pay attention to the ads, because sometimes too many ads is just as much of a negative as seeing one good ad.
Well, and not only that, but you know, sometimes it's just people just get caught up in the, you know, shaking their fists at the clouds, or you know, in the hate, whatever you want to say. Because if you scroll through Meta, or at least when I do, and I see an ad, it doesn't really matter what the ad is for. Like it could be an ad for a car or something, and all of the responses to the ad, it's all like the mean face, the nasty, like angry face. And if they have the comments open on the ads, it's just people venting about random things. It's like, this is why we can't have nice things. We can't have this conversation because the angry folks just come out. So I would say that from a healthcare standpoint, know that if you're running ads, there's probably going to be some people that are going to have some negative things to say. There's probably going to be some people that have some positive things to say. But if you're providing education, clarity, credibility, those things, they matter a little bit more from an ad standpoint sometimes than promotion or trying to be clever or trying to like get a conversion out of someone. It may just be better to say like, here's general awareness, and know that you've got to kind of monitor that for what some of the conversation is going to be, because you never know who is going to pop on there and leave a comment that you need to address.
Yeah, totally. I think the next piece that the report came out with, which I love, is that influencer skepticism reinforces physician as expert content. So the report talks about influencer conversations are up 20%. Authenticity mentions are up 66% this year, and finance influencers have a 40% negativity associated with them on social. So from a healthcare standpoint, we know what patients care about. They care about the doctors. So patients trust credentialed experts. Like, this is your opportunity, doctor, to show that what you know, and to say it in a way, because you're wearing scrubs or a lab coat, people are going to trust you. They trust lived experiences, and they trust being transparent in those disclosures. So if you can put your doctor in front of the camera, or, being the one responding on social media, you're building trust across the board. And it doesn't have to be like the super polished influencer style of things. You just need to put your doctor in front of your potential patient on social, and, the people will do the rest.
Right. Exactly. Yeah. Having, real providers or real patient stories, those do so much better than kind of like generic influencer deals or whatever, which, I just did some of those, an influencer deal, and yeah, got a decent amount of impressions. I don't know if it really moved the needle at all. I think you're right. The credentialed expertise, it matches what the audience says that they really want to see and that they trust right now. So it makes sense to 100% lean into those. Absolutely.
Well, it kind of goes back to trust. Like, I think trust might be the theme of 2026. But if you put a doctor who is a trusted source in social or on camera or whatever, like it's going to pay dividends. And thank God, because we've been talking about this for years. I mean, there's so much noise out there. So when you put a doctor in there and the doctor tells you, then, and that's the law, then that's the law, and you're good. You can move on.
Right. Yeah, absolutely.
So the next trend, kind of like something that speaks to your heart, because we talk about it all the time, but AI anxiety mirrors healthcare specific concerns. What does this actually mean?
So essentially that AI conversations are growing across pretty much every industry. If you go to any website, it says it's got some type of AI assistant in it now. My email app now has an AI assistant just for me. And I check Gmail just in case I have an AI assistant in there too that suggests replies. It's everywhere. And of course there's mixed sentiment on that. There's optimism when AI can help, because if you go somewhere and you've got a pretty good chat bot, it can answer some questions, and that's great. And then there's backlash when it replaces the human interaction piece of it. So, you're to an extent, you're kind of damned if you do and damned if you don't. This matters specifically for healthcare when we're talking about AI to help scheduling, or a chatbot on a website to answer, generic billing, location questions, that kind of thing. There's also AI-driven triage, which we're seeing a lot of now, to kind of help guide people down the right path. That can either be on a website or on a phone. I was talking to someone a couple weeks ago, actually, who wanted to explore doing some AI-driven answering systems so that it kind of just seemed like you were, talking to a person. I think that on social, a lot of people, again, and it just kind of depends on what context we're talking about, but a lot of people clearly are mentioning AI either in a positive or a negative light here. For healthcare specifically, I think patients kind of accept the idea of AI if it's going to either improve access or it doesn't replace empathy. If we try and fake empathy, which some do, some AI companies do with these chatbots and things, that's where it can get kind of hairy.
I fake empathy all the time, and I'm not a chatbot.
Well, yeah, but you fake it so well.
Yeah, I do.
Yeah. And then of course you got to have like a clear human kind of fallback. Like if you don't, and it's just AI or bust, I think that's where a lot of specifically like larger systems and things like that are getting into trouble. But for an average practice, I would say if you're gonna talk about implementing some type of AI, absolutely we should be doing that, because that is going to become the consumer norm. But just know that on social, there is the potential to have backlash, just like anything else, just because people will find a reason to have a problem.
I think it goes back to something you said really sticks with me a little, and like talking about AI as improving access. So we did an episode recently where we were looking at the 2025 consumer trend survey that Press Ganey put out, just talking about like the number one issue that patients are bringing up related to that kind of patient journey is access, and how if you're a practice and you don't have online scheduling at this point, like you're missing out on patients. And I think this is like a great case in point. Like if you can put up a chatbot, let's say, that feels like a conversation about scheduling, there's HIPAA compliant chatbots that might check the box for you. It's not fully what you need, but it might check the box in the immediate, and you can get those up in a couple days. But AI is built into the online scheduling now. AI is built into the post appointment, reputation invitation to leave a review. AI is built into the social conversation, into email, into everything else. Sure, there's a lot of anxiety around it and what that means to your practice, but if it can make access or the perception of access better, or empathy, or you name it, then all the better. And here's the thing, guys, just like this thing called the internet didn't go away, or Google reviews didn't go away, AI is like, they got their foot on the gas pedal, and it is going to be a different world next year. So we might as well get in front of it and embrace it a little bit now.
Yeah, absolutely. And, AI will help, in theory, make it a little bit easier to have platform specific content, which is kind of the next thing that's on the Brandwatch list here is platform specific expectations matter for healthcare. Basically saying that healthcare brands can't just kind of copy and paste content across different platforms, because the conversations and the norms look totally different. If you're on TikTok versus LinkedIn or Reddit, it's a different user, it's a different conversation that's happening, it's different content. So if you're copying and pasting, you often kind of find yourselves out of sync with what the user expects in that space. And so that's going to change how they react to it, or if they react to it at all.
Yeah, I talk to our team about this all the time, because we'll build social for clients, and, we'll pre-build a bunch of stuff. And we know, some of the stuff's not going to get engagement. That's why we try not to put too much energy into what we refer to as evergreen. And we try to focus on that in the moment. But I'll tell them all the time, like, you can't put this post that we just put on Facebook on LinkedIn, because not only is it just the wrong content for the wrong platform, it also erodes the trust as well. Because, you're over here talking about something silly on Facebook, which is great, but then you go onto LinkedIn and you can't be having that same silly conversation. LinkedIn's a great place to talk about, patient, like doctor referrals, or work comp, or employer focused marketing, or, we're getting ready to expand a location. It's just the message is different from platform to platform. And I think this report is kind of reinforcing what that is.
Yeah. And if you
don't have to be everywhere, you can be just one place, but get it right.
Right. Because if you misuse that platform, that's going to damage trust, and then you're just creating extra work for no benefit.
For the sake of it. Extra work because one person said, I think we should be on TikTok. No, you should not. You got to make the right decision for your practice. So let's wrap this up. All right. There's a couple of kind of key takeaways. Let's start with social media reflects patient experience in real time. And that is the truth. This is like social media is the echo chamber, and this is where the patient experience starts and ends.
Yeah, exactly. And sometimes you're not even around for those conversations. So again, you can control the things that you can control, and then it makes sense to have some type of listening service or monitoring service, so you can see what some of the mentions are about your practice, because there's definitely advantages to knowing what those things are. One, so you're in the loop, and two, I think it's a great learning opportunity to say, there's been a lot of feedback on social about X. Let's respond to it and change Y.
Yep. Next takeaway, trust, transparency, and service matter more than reach. Man, isn't that the truth?
Yeah, I mean, I don't think I really have a lot more to add to that. That kind of says it all.
Yeah, it really does. Just like most healthcare reputation is built when the practices aren't even present. Like it's really about what people say about you when you're not in the room. And that applies to whether it's your personal reputation or the reputation of your business.
Yep. Yeah. And then education, empathy, and responsiveness outperform promotion. And again, I think that just leads back to what we want to do as healthcare marketers, or on the clinical side as well, that this idea of helping people, educating, being responsive to them, that telling those stories is going to do so much better than just saying, hey, click here to buy this thing.
Which a lot of doctors, like, especially like in the med spa or the beauty space, they want the click here to buy this thing. And it just doesn't resonate the way that it used to. I think this resonates with me, is that social is no longer optional for reputation management. With reputation management, a lot of times it's talking about Google or Healthgrades or, RateMDs or whatever it is. Social media is the place for your reputation.
Well, yes, I agree 100%. And I think the thing to remember is that the internet doesn't forget.
No.
So it becomes
not forgiving or forgetful.
Right, exactly. So it becomes kind of the public patient experience where it's documented, it's searchable, and unfortunately, sometimes, like we were talking about earlier, it can be shared at scale.
Yeah, it really can. So, in closing, healthcare, social media, it's not just about marketing. Social media is the public version of the patient experience, and you need to be paying a lot of attention to how social is evolving and make sure that your practice is evolving with it.
Yeah, and I think to me, one of the big kind of final takeaways is that whether you're paying attention or not, these conversations are happening. This experience is happening, and you can only do so much to control those things, but you can listen, and you can learn from it, and you can improve it.
That's right. So with that, I'm Jennifer.
I'm Corey.
We'll see you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Bye, guys.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.